Hello everybody, my name is Dr. Herman and I'm owner and CEO of Liberty Chiropractic and Wellness Center, and we're going over some treatment and some diagnosis with my patient Chad. Chad gave me permission to film this. He's been having chronic and severe pain in his lower back area and some shooting down into his thigh, which I'm suspecting is the sciatica. Very often sciatica is related to a weakness or a spasm in a muscle called the piriformis muscle, which is deep underneath the glute muscle. So I'm going to check that muscle to see if it's responding weak or not. So bend your knee up again, Chad. Bend. Hold here. Don't let me pull out. Ready? Okay. So that he cannot resist. We checked it before, so I know. I just wanted to confirm for the camera. Now there's what's called a neurolymphatic point that's taught in applied kinesiology to check for to see if that can strengthen the muscle. Excuse the ring. So what we're going to do is have Chad touch the neurolymphatic point, which is just below the bladder and right on the pubic bone. And now we're going to recheck that muscle. Don't let me pull out. And is it stronger? Yes. Okay. So the fact that touching it made it stronger tells me that that's where he needs to be treated. So we're going to, we can either rub with the finger and do some acupressure, or we could use an instrument. I tend in that area to like to use what's called a vibrocussor because it is soft and a little more forgiving to the patient for the treatment. So we're going to find the bone. Is it tender? Yeah? Yep. Okay, and we're going to do some massage right in there, vibration and percussion. If you're doing this technique, always ask the patient prior if they need to empty their bladder, which I didn't.
I just did when I came in.
Alright, good. So we do this, about 20 seconds, 30 seconds or so. And it's very sore in that area, isn't it? I always find that the area of involvement that needs to get treated is sore. There's two techniques that teach this. One's called applied kinesiology, you can find it on the internet, and one's called Touch for Health, which is an offshoot of applied kinesiology. Ouch.
Yep.
You're sweating. Okay, we won't torture him anymore for now. Now I'm going to go back and recheck that muscle. So bend your knee, hold it here, do not let me pull out. And I'm giving it pretty much 90% of my strength. When I did that, it was stronger, yes?
Yes.
But did you feel as much pain pulling out then? Okay.
Not nearly as much.
When you came in here, were you feeling pain in your lower back and your glute?
Yes.
Okay. Can you sit up, stand up, and maybe walk around a little bit, and tell me if just from that any of the pain has changed? I don't know. Sometimes it does and sometimes it doesn't.
Yeah.
Maybe bend, do whatever you need to do that usually makes the pain get worse.
Yeah, I think it's better.
It's better. Okay. So that's just part of the techniques that we do aside from chiropractic to treat the body. Now I'm going to actually check his sacroiliac joint and his lower lumbars, which are also usually involved with sciatic problems. But that's it for now. Thank you very much. Okay, we're back and with Chad, and now we're going to evaluate his lower lumbar spine and his sacroiliac joints, because those also are usually involved with sciatic pain. So I'm just going to feel. And it's typically the lower lumbar, like L4, L5, L3. So when I come to about L4 and I push, is that tender?
Yep.
Okay. If 10 was the worst pain, what pain would that be?
About a 7.
About a 7. So that tells me, plus it feels compressed, it's not moving like it's supposed to, that also is an area of involvement. Let's just check for the sacroiliac. Any tenderness here?
No.
Okay. Doesn't feel like the sacroiliac is involved. So now what I'm going to do is I'm going to do a side posture chiropractic adjustment on L4 to relieve the subluxation. So Chad, if you could face me on your side. Good. Now don't fall off like you did last time. You're going to embarrass me on the film. Okay. So we're going to relax. And I'm going to come here. I'm going to put my fingers right on the L5 vertebrae. And I'm going to put a little pressure downward. There it goes. Ah. Now come back on your back. How'd that feel? Relief?
Yep.
Okay. Again, just for the heck of it, hands off your body. I'm going to check this muscle. So bend up and don't let me pull out. Ah, that was 95% of my strength. Any pain when I did that?
Very little.
Great. That would be a very successful treatment for sciatica. And that's it for now. Thank you.